are here now with Dr. Frank Veith. This is the second time I have the pleasure to perform an interview to Frank Veith. He's probably the most known vascular surgeon around the world, responsible for many of what we are doing right now. And I would like to have the privilege to ask him about the future. And the first thing I want to ask him, welcome him, and ask him is about the next Veith 2014 Congress. Please, can you reveal some secrets for the next year? So we are going to attend as usual, but really encouraged to go for new things on New York.
Well, first of all, it's very nice to be with you. I appreciate that. And about our meeting in this year, although we make the meeting, it's really the people who have good things to say, important new information that make the meeting. And there's just a lot of new developments this year that are going to be very exciting, new and controversial. And one of the things about our meeting is we try to present both sides of a coin, the pros and the cons, and we get enthusiasts for one side to present their view, and then enthusiasts against that view to present the opposing view. So there'll be a lot of that. The exciting areas this year, from my perspective, are certainly dissecting aneurysms. There's just a wealth of new information and a great deal of improvements that can be made in the care of type B aortic dissections. So that will be a very popular topic, I think, and we have many talks on that. Still, the carotid controversy goes on. To stent, to not to stent, to use medical therapy, surgical therapy, stenting. And we have lots of talks and opinions about that. So I think that's still an exciting area. And the old trials are now old, but there's new information appearing, new techniques, ways to better carotid stenting. So we've entitled one of our sessions, The Future is Bright for Carotid Stenting, because I believe the future is bright, but we have to get the evidence to prove that. Okay. There's also a lot of good and interesting controversy about treating vein stenosis for multiple sclerosis. That is continuing to be interesting. There are just a lot of new areas. And one of the other very exciting areas, lower extremity endovascular treatments. And what is their role? When should the new treatments be used? The drug-eluting balloons, drug-eluting stents, smaller profile systems. There's a great deal of new and exciting information, mostly from Europe, by the way, on new technology and its application in the lower extremity. And there's still a lot of controversy. What's the residual role for vascular surgery? I happen to believe there's still a role for it, but some people are going to say there isn't. So all these are exciting. And there are a lot of other new technologies. We're doing a lot on renal denervation, because renal denervation had a very negative trial, the Simplicity 3 trial, but I don't think that's the end of it. I think that that may be a flawed trial, as may be the trial showing that drug-eluting balloons below the knee don't work. I think they probably do work. So why these trials are negative, that has to be explored. Where we're going in the future, all that, I think, will make for an interesting meeting.
Okay, so it's a very exciting time to be in New York for the next year. This year,
it's
right? Next year.
Exciting time to be in
next Congress this year.
To be in vascular treatment.
Yeah.
Because it's the treatment that makes it exciting. Sure, Barcelona's an exciting city, New York's an exciting city, but the meeting is really what's most exciting, because there's a lot of good new material to expose.
Yeah, another thing that I'd like to ask you is, being the fifth Congress you've organizing, so how are you doing for 5 years, 6 years, 7 years, so many years doing such a good job in the Congress? How can we manage that? How can we do that to apply in our own congresses?
Some of it is luck. It's lucky that we were in New York City. That is an attraction to people to come. It's easy to get to by air travel. We're trying to appeal more and more to out-of-U.S. attendees from China, from even the Middle East, certainly from Europe, where they already come, from Asia. And that is our area for growth and of the meeting, to get more attendees. And we were lucky also in the way we arrived at short talks, because people seem to like short talks. They don't want somebody droning on with unnecessary, well-known information. They want to know what's new and just the take-home message. So we arrived at that, and that helped our meeting a lot. And other people are copying it, of course, but we did it for, it was good luck, fortuitous reasons. We wanted to get a lot of speakers on, and the only way we could do that in a limited amount of time was to give everybody a short period to speak. And we got the idea somewhat from public television, lay television, where if they interview Henry Kissinger or the Prime Minister of Britain, they give them 2 minutes to talk and then say, that's it, we'll have you back. So that sort of was a stimulus for us to do the same kind of thing. So
you really don't want to tell us the secret of being so successful for so many years?
No. The other thing is that the connection with industry, which the U.S. government and many institutions are trying to break the relationship. We think the relationship with industry is, in the long run, beneficial to patient care. It's good for people in general. It's also good for us. And we very early on linked up with industry to get them to support our meeting, because they deserve to be able to promote what they need to promote in an honest, unbiased way. And we think we did that, again, with some luck, pretty well. And that helped our meeting, and now lots of people are doing that.
Well, I have a personal feeling about that. I think that the key of the success of the Veith Congress is Frank Veith, but I will not tell in front of him right now. And I also like to make a final question. Is this, tomorrow we are going to be discussing about unmet needs and the future, and in a way, in different way, not so based on the evidence, more in the feelings and in the ideas. Which are your feelings for the next 10 years in terms of endovascular therapy?
Endovascular, I can remember in 1994 and 1996 predicting that endovascular therapy was going to replace 40 to 70% of open surgery. And I was ridiculed for that. People said I was crazy and I didn't know what I was talking about. But it's turned out that was on the low side, not the high side. I think now, with what we're seeing with these new complex grafts for complex aortic aneurysms and other lesions, I think we're going to see up to 90% of what we treat will be treated endovascularly. That, I think, is the future. Of course, some of it's controversial, and it will always be. But I believe that is the future, and that also helped our meeting, because we embraced endovascular early, before other surgical groups did it, and that proved to be a winner.
Okay, so thank you very much, Dr. Veith, for being with us this evening, and it was a pleasure and an honor, as always, to interview you. Thank you very much. I will see you next on endovascular.tv.
Okay,
thank you.
Thank you.